In today's tutorial, we are going to talk about the anatomy of the ulna and radius. We are going to cover the ulna and radius structures, their landmarks and their importance. So the forearm is composed of two primary bones, the radius and the ulna. These bones are essential for arm movement, stability and function, enabling activities such as lifting, twisting and grabbing. Understanding their structure, bony landmarks and significance is crucial for students of anatomy. The radius and ulna are the two long bones of the forearm. They articulate with the humerus at the elbow joint and with the carpals at the wrist joint. The radius is the lateral bone of the forearm positioned on the thumb side, while the ulna is the medial bone positioned at the side of the pinky. These bones are connected by the interserous membrane, which stabilizes them and serves as a point of attachment for muscles. Let's go over the bony landmarks of the radius. The radius features several important anatomical landmarks. Number 1. The head of the radius. A smooth rounded structure at the proximal end forms a synovial joint with the ulna. This allows for pronation and supination, the rotational movements of the forearm. Number 2. The neck of the radius. A narrow region just below the head, providing structural supports. Number 3. The radial tuberosity. The radial tuberosity is a bony prominence below the neck. It serves as a site of attachment for bicep bronchi muscle, which plays a key role in forearm flexion. Number 4. Styloid process of the radius. A pointed bony projection at the distal end, which serves as a point of attachment for the brachioradialis muscle and the wrist ligament. Let's talk about the bony landmarks of the ulna. The ulna, being the more stable of the two bones, has key landmarks that contribute to elbow function and stability. Number 1. The olecranium process. A large curved projection at the proximal end, forming the bony prominence of the elbow. It serves as the insertion point for the tricep bronchi muscles, which is responsible for elbow extension. Number 2. Coronoid process. A hook-like projection just below the olecranium, serving as the insertion site for the brachialis muscle, which helps to flex the elbow. Number 3. The trochlear notch, a deep concavity that articulates with the trachea of the humerus, allowing for flexion and extension of the elbow. Number 4. The head of the ulna. Located at the distal end, it forms part of the distal radio-ulnar joint, allowing for forearm rotation. Number 5. The styloid process of the ulna. A pointed structure on the distal end, providing attachment points for ligaments such as the ulnar collateral ligaments of the wrist. Now let's talk about the clinical indication of the radius and ulna. A deep understanding of this bone can help in diagnosis and treatment of fractures, dislocation, and joint disorders. For example, Cole's fracture, a common injury which occurs when the distal radius breaks due to a fall on an outstretched arm. Then you also have surgical and orthopedic relevance. A surgeon must be familiar with these bones for procedures such as fracture repair, joint placement, and ligament reconstruction. So the ulnar radius plays a fundamental role in arm function, movement, and structural support. Their bony landmarks provide important attachment points for muscles and ligaments, allowing for essential forearm motions. Learning about these bones is valuable for medical professionals, athletes, and anyone interested in human anatomy. So, if you like this video, please consider subscribing and also liking the video. Thanks for watching as always, and see you in the next one.